I'm Dr. Jack Kevorkian, licensed doctor in Michigan. Do you want to go on?
No, I don't want to go on.
You don't want to go on living?
I don't.
There's been an increase in legalization of euthanasia-assisted suicide in developed countries.
Both are legal in the Netherlands, Belgium, Luxembourg, Colombia, and Canada. Switzerland, along with 5 U.S. states, Oregon, Washington, Montana, Vermont, and California, offer physician-assisted suicide. The interventions are rare. In the Netherlands and Belgium, less than 5% of all deaths are by assisted suicide or euthanasia. In Washington and Oregon, only 3 in 1,000 deaths are by assisted suicide. However, not every case is reported, so it's impossible to tell if these are true rates.
Euthanasia is the deliberate action of killing, under the impulse of compassion, in order to relieve the physical pains of a person suffering from an incurable disease and whose death is inevitable. There are 2 forms of euthanasia, active and passive. Active euthanasia occurs when death is brought by an act, typically using medication. Passive euthanasia occurs when death is brought by withdrawing or withholding treatment. For example, switching off a machine that keeps the patient alive.
Public support for euthanasia-assisted suicide is quite interesting. It's more supportive of euthanasia. It increased from 1947 to about 1990 and then plateaued. And over the last few years, there's been about a 5 or 10% decline in support.
Why should euthanasia and physicians-assisted suicide be legal?
It shouldn't have to be an illegal act, a suicide act, where you shot yourself or did some other very violent thing to end your life. That you should have a dignified exit possible when the pain was too much and there was no quality left in your life, that each individual have the right. Not that the state should choose it, not that anyone else should choose it, but the terminally ill person should have that right to choose, and it should be done in a dignified and legal way.
What is the difference between euthanasia and physicians-assisted suicide? Euthanasia occurs when a physician administers a lethal dose of medication to a patient. Physicians-assisted suicide occurs when a physician prescribes a lethal dose of medication that the patients must administer to themselves. What is the controversy surrounding euthanasia and physicians-assisted suicide? Much of the controversy comes from different religious views. Many religions view euthanasia and physicians-assisted suicide as immoral, as the patient is taking their life into their own hands rather than letting their God decide.